Good morning, everyone. I am Dr. Ahmed Kadle, Rector of Abrar University, Somalia. Thanks, Professor Rafael Vieira, for inviting me to deliver this One Health in Leadership, an interesting topic for me. I will be giving an overview of One Health in general, and then how to inject the One Health concept and the One Health perspective into our political, public, and private leaderships at different institutions. One Health recognizes the close links and interdependence between human, animal, plant, and environmental health. The One Health definition, recently developed by the One Health high-level expert panel, states that the One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. It recognizes that the health of human, domestic, and wild animals, plants, and the wider environment are closely linked and interdependent. This ensuring One Health approach is an essential part for progressing in order to anticipate, prevent, detect, and control diseases that spread between animals and human, and that threats, as well as combat, tackle antimicrobial resistance, AMR, and then ensure the food safety, prevent environment-related human and animal health threats, as well as combat many other challenges. So One Health is an critical for achieving the UN Sustainable Development Goals. Okay, the approach that can be applied at community, academic, subnational, nationally, regionally, and also global-wise relies on shared and effective leadership. For this One Health to be successful, it is linked to the effective leadership and governance with communication, collaboration, and coordination. Historically, the concept of One Health is not new. And historically, it can be traced back to the Prophet Adam's era, the beginning of life, the beginning of the human life, when the crow, Allah or the God, sent crow that shows Kabil how to bury the corpse of his brother Habil. This the two of them are sons of Prophet Adam, and then the Kabil killed his brother, and then the crow showed him how to bury this corpse of his brother. So in the sense of the One Health concept, discarding these corpses or these dead bodies from the environment, burying it under the ground, it prevents the human life, animal life, plant, and environmental health. So imagine if from the Prophet Adam till now, the corpses are scattered in the ground. So this affects our health, our ecosystem, and our animals. However, the term One Health was first introduced into the global scientific community in 2004 at a meeting of the Wildlife Conservation Society, while in Somalia, the term was used in 2013 at the time of the One Health conference in Ethiopia, the first conference that was organized in Ethiopia by a network that was established in East and Central Africa, where I had contributed to the country presentation of for One Health activities for Somalia that will be presented, and that was presented by the director of animal health at that time. So it is now 20 years old in the global context and 10 years old in Somalia that when the term was introduced. So there is a long road ahead to achieve better health outcomes for human, animals, plants, and the environment. So why One Health in leadership is so important? As we have said that One Health is not a new idea, but it is one that has become more important in recent years due to changes in the environment and the emergence of several new zoonotic diseases. As veterinary, we know that most of human diseases are from animals, and nowadays more than 75 of emerging infectious diseases are from animals. So the planet now supports a human population of more than 8 billion, and that number is projected to grow up to 10 billion by 2050. That growth has caused the human to expand into previously uninhabited area and to come into closer and more frequent contact with animals, both wild and domesticated. And this facilitated the disease to be transmitted and emerging of disease. Combine that with a rapidly changing ecology, urbanization, climate change, as we have experiencing nowadays, increased travel and fragile public health systems, epidemics will become more frequent, more complex, and harder to prevent and contain. Through the years, our lives and societies have been impacted by several diseases such as Ebola, influenza, and COVID-19. So greater collaboration between us will build the health system and is needed to protect everyone's health from the impacts of zoonotic disease, as strongly reminded by the recent emerging diseases with animal origin. In 2004, the Manhattan Principles on One World and One Health demonstrated this call for action with 2004 conference summary stating that the participants urge the world's leaders, civil society, the global health community, and institutions of science to institute the 12 specific principles. So, with this pandemic COVID-19 and Ebola, the risk of many emerging and re-emerging infectious diseases of zoonotic nature, as well as the spreading of antimicrobial resistance, One Health has become one of the top concerns globally, as it entails the essential global public health challenges from antimicrobial resistance of zoonosis to the current climate change, the food security, as well as the social well-being. As you can see in this picture, in this video, where cattle are crossing from crossing the river. This is the river, one of the rivers in Somalia. Crossing this river from here to up to the other side, and humans also swimming and taking water for their consumption and domestic use. Then the adoption of One Health abroad is more important, which supports local, national, and global health security by improving coordination, collaboration, communication to address shared health threats. As still we are in the One Health and leadership, the importance of it, as you can, in this part, there is abundant evidence that no single sector can sufficiently manage the challenges of public health in any country or continent. So experiences from the fight against COVID-19, Ebola, highly pathogenic avian influenzas, demonstrated the effectiveness of multi-sectoral, multi-agents approaches and the need for specific training targeting multi-sectoral and multidisciplinary approach of public health professionals, not limited by national or regional borders in dealing with public health threats. In response to these challenges, the One Health approach has been advocated as the global framework for strengthening collaboration and capacities the sector and actors involved in the health service delivery. Many disciplines needed to be integrated, including not only epidemiology, but also social science, research and development, as well as diplomats, logistics, and crisis management. This requires new approach to train tomorrow's leaders in public epidemics of prevention and response in this epidemics and pandemic area. So as we know that leadership is often tested during the crisis time, and many of it was tested in this COVID-19 and also the other outbreaks that occurred in recent years. As COVID-19 cases and deaths mounted globally, some governments manage it better and the others are not managed well. And this was entirely up to the leadership of those governments. So these videos that we are showing you currently shows how successful the response could be if the leader understood the concept and the threat of the diseases. So if our leaders, if the One Health injected to the leaders and the leaders understood the concepts and the threat of that crisis, so it has a successful response. So let's see these videos. Starting on Bolsonaro, the former president of Brazil.
Bolsonaro strongly opposes any restrictive measures.
We won't accept measures that force us to stay home. The COVID-19 virus has come to stay, as others have in the past.
And then to Trump, former president of USA.
Wash your hands, stay clean. You don't have to necessarily grab every handrail unless you have to. You know, you do certain things that you do when you have the flu. The Democrats are politicizing the coronavirus. You know, for today, I am officially declaring a national emergency. Relax. We're doing great. So we slashed red tape to develop vaccines and therapies.
And then to Prime Minister of New Zealand.
Our plan is simple. We can stop the spread by staying at home and reducing contact.
All across the country, stores are emptying and so are the streets as New Zealand gets ready for the lockdown.
Non-essential businesses in New Zealand must now close. All bars, restaurants, cafes, cinemas, pools, playgrounds.
Were we overreacting? Some people said we were. And certainly when the scientists say shut the borders and lock down the country, that's quite a hard scenario to justify. We'd predicted that after we locked down, the cases would continue to go up.
There are 40 new confirmed cases. There are 50 new, there are 78, there are 85 new cases of COVID-19 in New Zealand.
We all held our breath as we saw the numbers start to level out and realised that the lockdown was probably working.
The WHO guidance on how to respond effectively to the pandemic was really clear. The core public health measures of testing, contact tracing, isolation of cases and close contacts were fundamental to being able to break the chain of transmission in our community. We had already established our testing capacity and we continued to increase that and started to test more widely.
In the past 24 hours, more people have recovered from COVID-19 than have caught it.
Pleased to report that today there are no new cases of COVID-19 in New Zealand. Good news, our 13th consecutive day of no new cases. A really core part of our success in this was the coherence and comprehensiveness of our communication campaign.
I'm speaking directly to all New Zealanders today to give you as much certainty and clarity as we can as we fight COVID-19.
It was really important to have very clear and consistent messaging.
This is a COVID-19 announcement.
That helped the population to understand the why and also what was expected of her. New Zealand got to a point where we had 24 days without a new case, and we're effectively have been able to open up most of the economy, but with still very stringent border measures.
What's your
immediate reaction when you heard there were no active cases of COVID-19 remaining in New Zealand?
I did a little dance.
We are really only at the end of the beginning, and we need to make sure we remain vigilant and don't undo all the good work we've done over the last few months.
And so while the job is not done, there is no denying this is a milestone. So can I finish with a very simple thank you, New Zealand?
So this gives us the leadership when understands the concept. It could manage better response and successful control and prevention of the diseases.
It's hard to believe that just 2 months ago, this virus, which has come to captivate the attention of media, financial markets, and political leaders, was completely unknown to us. This outbreak is testing us in many ways. It's a test of political solidarity, whether the world can come together to fight a common enemy that does not respect borders or ideologies. It's a test of financial solidarity, whether the world will invest now in fighting this outbreak or pay more later to deal with its consequences. And it's a test of scientific solidarity. Will the world come together to find shared answers to shared problems?
Leadership is often tested during the crisis. Also, COVID-19 is still not finished, but WHO director gives the brief in early of this year.
COVID-19 will no doubt still be a major topic of discussion, but I believe and hope that with the right efforts, this will be the year the public health emergency officially ends. The last years have been tough on our collective health, but I remain confident and steadfast in the belief that only by working together can we harness and share science, deliver solutions that save lives, and build solidarity to counter the health challenges we face. Happy New Year.
So let's cross our fingers and hope the pandemic ends this year. Another example of how incorporating One Health action is into our leadership thinking about health-related preparedness and response is so important. Uganda's president addressed Ebola outbreak in September last year, and he took the lead to control the disease following following the Minister of Health guidelines. Surprisingly, competent leadership and the involvement of highest political leaders in responding to the outbreak led them to end Ebola disease outbreak in less than 4 months. So this is the leadership, and this is what we need to inject our One Health in action into our leaders so as the response is to be quick as possible. So Uganda has shown that Ebola can be defeated when the whole system works together. From having an alert system in place to finding and caring for people affected and their contacts, to gaining the full participation of affected communities in the response.
Movements into and out of Mubende and the Kasane districts is prohibited. I congratulate the government, health workers, and the people of Uganda for your leadership and dedication, which have enabled this Ebola outbreak to be contained in less than 4 months. I commend the government of Uganda for declaring the outbreak immediately after it was confirmed and notifying WHO as required under the international health regulations. We thank donors and partners for swiftly mobilizing resources and vaccine developers for making candidate vaccines available in record time. Even in the absence of approved vaccines or therapeutics for this species of Ebola, Uganda was able to use proven public health tools to contain the outbreak. Congratulations. I salute the dedicated health workers, partners, and communities who work day and night to save lives. This outbreak has finished, but WHO's commitment to Uganda has not. We remain committed to strengthening Uganda's health system as part of its journey towards universal health coverage and a healthier, safer, fairer future for all the people of Uganda.
Always, competent leadership can be successful in responding and preventing the crisis, whether disasters or health threats. So now we are talking about the One Health in academic leadership, going to the leaders of academics, universities, and other institutions. So academics, institutions are important places for promoting One Health by creating an enabling environment for training, research, and practice that generate sustainable solutions for One Health problems. In this slide, I will talk about the practical factors of how One Health trained academic leaders positively impact the country by laying down the foundation for operationalizing and institutionalization of One Health action in the country. This is my journey leading One Health in my country, Somalia. In 2017, in Doha, Qatar, my master degree supervisor, Prof. Dr. Abdullah, who attended the International Congress on Pathogens at the Human-Animal Interface, shortened as ECOPI. This Congress is designed to bring world expertise in One Health. In this Congress, he met with my PhD supervisor, Professor Rafael, and discussed the availability of a PhD positions at his university, the Federal University of Paraná, located in Curitiba, Brazil, for building the capacity of the staff of Abrar University in Mogadishu, Somalia. Fortunately, I got the PhD under the supervision of Professors Rafael and Abdullah on my favorite field, One Health, which I have been practicing since 2013, a decade ago. So I did in my One Health in research field at UFPR, starting 2018 and finishing in 2020. After I graduated, I got director position the chancellor position, the president of Abrar University. Immediately, I established the first ever One Health Center in Somalia, with the goal of enhancing the health care for humans, animals, plants, and their shared environment in our country through collaborative, multi-sectoral, transdisciplinary approaches in education, research, and outreach programs for community engagement, as well as the advocacy to the government level. So in this, the center organized the first One Health conference in 2022 and brought together policymakers, experts in the fields of human, animal, plant, and environmental health, innovators, private partners, and other stakeholders involved in the area of One Health to build the capacity of my community, Somali, including the policymakers and political leaders, in order to promote the institutionalization and implementation of One Health in action in Somalia. Fortunately, the One Health conference was officially opened by our current president, His Excellency Dr. Hassan Sheikh Mahmoud, and we thank him for his contribution to the success of this and for willingness to continue to support the One Health initiative and the education sector as a whole. Also, I would like to thank Professor Rafael, who contributed to this conference in his area of expertise by sharing his experiences on vector and vector-borne diseases and discussing the future perspectives of One Health aspects on vector diseases management. The following the conference recommendation is on institutionalizing One Health within the government system. Our institution sent an email letter to the Prime Minister office, and then for calling institutionalizing One Health at the highest government level and suggesting the formation of a Somali One Health Council under the Prime Minister office, integrating One Health into top leaders is the key to the success of One Health in the country and worldwide, as we have seen in the responses to the recent pandemics. With the purpose of building the capacity, One Health Center sent students to the Federal University of Paraná in Brazil under the supervision of Professor Rafael and other professors at their institution. We also have One Health research projects with other partners around the world. In general, Somalia is underrepresented in the global and Africa One Health network. This led us contribute to do a One Health regional network for the Horn of Africa, which is just formed in last month. So practicing the One Health concept in Somalia requires the policymakers, health and environmental professionals work together to institutionalize One Health in the government system and engage the community. We always forget the community. Let us do the government level, the professionals level, and then the community level. All together, we can succeed in a healthy way. Also, last month, we participated in a zoonotic disease prioritization workshop for Somalia using the USACDC tool. And our institution was the only academic institution and that was among the voting members. There's a voting member, there's a facilitator, there is advisors. So voting member, it must be for government officials. So as we have in-depth expertise in One Health and zoonotic part, so we join it the voting members so as to review as government officials from different ministries for reviewing and approving the process, as well as the final list of prioritized zoonotic disease. Immediately after we finish it, then we announce it to organize a series of webinars on recently prioritized zoonotic diseases, aiming to foster One Health competence among students who are future practitioners, health professionals, and decision makers. These webinars will be broadcast via Zoom on second Wednesday every month from April to November 2023. Government officials and heads of WHO, FAO, World Organization for Animal Health are all joining in the opening remarks. In opening remarks, it gives us the opening webinars gives with this high level officials from the government and higher officials from international organizations, gives the importance of now in the recently zoonotic diseases so as to be easier for later on to do the responses and preparedness for these prioritized zoonotic diseases. The webinar will be presented by experts from around the world. Liverpool and UK, Ethiopia, WHO, ILRI and Liverpool, from Sudan, from UK, from Germany, and one of our products will moderate this webinar series. And as the professor now with you at North Carolina University, he transferred from UFPR to the North Carolina University. And I hope the collaboration and partnering will be started at your end and continue improving the One Health, at least in Somali part or in the Horn of Africa. As we have recently established the One Health regional network for the Horn of Africa, I hope the North Carolina will work together to improve the health system and health information and the One Health concept and in action in these countries. Finally, in conclusion, the involvement of highest level of political leadership and other leaders at the public and private institutions in One Health actions are necessary for making One Health approach a development priority in all countries. This suggests governmental power in the implementation of One Health. The government power in the implementation of the One Health, as we have seen in the Uganda part, the president works through the guidelines that gave by the health authorities. So the government power assisted and impacted the successful result that they reached within less than 4 months to end an outbreak in their country. So the government power in the implementation of One Health, budgets and benefit distribution across sectors, and transforming the policymakers and scientists' reactive to proactive mindset to effectively address health challenges and put biodiversity and ecosystem health, human health, animal health at the forefront of development agents. So we have to put the health of the people, animals, and the ecosystem at the forefront of development agendas of the governments. Institutionalization and ownershipity of One Health at all levels through a head of government to the community level will significantly contribute to the successful implementation of harmonized One Health initiatives to prevent the next pandemics. Thank you very much for your interest and attention. One Health is for all.